Welcome to this rapid revision video looking at 19th century public health. There will be some fairly detailed feedback in this, and it might well be worth making it full screen, making it HD so that it's as clear as possible, and at any time you can always pause it, take a screenshot and read it in your own time. So without further ado, let's have a look at what the problems were and how they were solved. First up though, let's consider what the Industrial Revolution really was. Well, this was a time usually considered to be between about 1700 and 1750 and the end of the 19th century, when there was a rapid development in industry and lots of change in people's work and lives, particularly in Britain, which we'll be focusing on. Part of the Industrial Revolution saw population growth. The population of the UK grew from 11 million in 1750 as an estimate to about 40 million in 1900, which is a much greater growth and more quickly than had been seen in previous centuries. People tended to move to cities to work in factories, and those cities quickly became overcrowded. As a result, there was poor quality housing. This needed to be built quickly, and they were built very close together and very cheaply. And towns were filthy. Sewage and rubbish quickly piled up in cities, leading to terrible smells and, as we'll see, disease. Ultimately, the cities grew too quickly for them to cope. The government initially was very against doing anything about this, but times soon changed. Problem number one relates to overcrowding in slums. As the cities grew, the number of people living cheek by jowl also increased. The second problem was the Great Stink. This happened in 1858. And the third problem was cholera. Some of these problems are related and some of them ran simultaneously, but we're going to take each in turn and have a look at how they were solved. The first problem is population growth. Before 1750, there were about 11 million people in Britain, and most of them lived in the countryside. However, by 1900, most people lived in towns and cities and worked in huge factories. The population spiraled to almost 40 million people. One consequence of this is that there was a big increase in the number of people, and these people, especially the poor, were crammed into relatively tiny areas. Slums developed, with one or more families crammed into tiny houses. Sometimes they were crammed into single rooms or even cellars. People tended to work long hours for low pay, and their health suffered. The old sewage systems, that had remained mostly unchanged since the Middle Ages, could no longer cope, and filth was everywhere. Take, for example, this open sewer or drain in the middle of this old photograph. The factories also belched out clouds of smoke and soot from coal fires, and people had no choice but to breathe in the smoke and smog this created, a smog being when fog and smoke combined into a dangerous mix. The second problem was the Great Stink of 1858. The severe overcrowding of the cities created horrendous living conditions. The sewage would flow in the streets and be washed into the rivers. The River Thames of the early 19th century was a wide, slow-flowing soup of sewage and filthy water. A nice thought, eh? The smell was literally unbearable. In 1858 there was a hot summer, and the Thames water levels fell. The stench of the river was so bad that Parliament had to meet elsewhere. It was so severe that people believed that the smell could itself kill. This was in an age before the germ theory of Louis Pasteur, whose work was published in the 1860s, and people were terrified by the smell or miasma that they believed could spread disease and cause illness. As it happened, the smell could not spread the disease, but the sewage and the filthy water could. Little could be done without the cause of disease being understood, however. Even less could be done without Parliament there to sort it out. And the third problem, cholera. Cholera was a deadly disease. It originated in India and was brought back aboard trading ships entering British ports from the Empire, which by the time of the Industrial Revolution, Britain had actually built up. I've got a separate video that looks at how cholera was defeated, but let's consider this problem. Cholera was often fatal, and it provided a very undignified and painful death for its victims. This is going to get a bit yucky. First, the victims suffered severe, often explosive diarrhoea. They also suffered from vomiting. This caused terrible dehydration as the victim lost fluids through vomiting and diarrhoea. Then the victim would suffer agonising cramps and painful joints. Their faces would become shrunken and pale as the dehydration worsened until the victim fell into a coma and eventually died. It usually killed in a matter of days. It could occasionally kill in hours. Here an artist's impression from the 19th century shows a healthy woman combined with her having suffered from cholera. A pretty horrifying and fearful way to go. Many cities were terribly affected by cholera, including Newcastle, Exeter and Liverpool, but London was one of the worst hit, and we'll mostly be focusing on London. Most people in power thought that it was caused by bad smells, the miasma theory. It wasn't, but it was caused by the sewage getting into drinking water. Bearing this in mind, it is hardly surprising it spread, given the fact that people use the same water to wash sewage away as they use to drink, wash themselves, and do the laundry. So here is our first page looking at the problems. I'm not going to read all this out to you, but you can always pause this and make a screenshot if you liked. However, what I will point out is, are any of these problems linked? Well, the answer is yes, they are. Both overcrowding and the Great Stink are linked, as the overcrowding and bad sanitation caused the stink of the sewage in the Thames. Also, both the Great Stink, overcrowding and cholera are all linked, because overcrowding caused dirty water, which in turn caused the cholera, and indeed the Great Stink. Not that the Great Stink in and of itself caused cholera. Also, overall, the most important problem was probably overcrowding. An example of this would be the inadequate sewers to cope with the population. This was most important because this problem directly led to the problems of the Great Stink and cholera. So what about the solutions? Let's have a look at those next. We will now consider the main solutions to the problems we've already described. We'll need to identify which solutions solve which problem, and how the problems might be linked, and indeed how far the problem was solved. Our first solution is Dr. John Snow. I've given him a more detailed mention on my video on cholera, but let's recap what he did. Dr. John Snow was the first man to correctly identify that cholera was caused by dirty water. In 1854, he noticed at Broad Street in London there was a deadly cholera outbreak centred on the Broad Street pump. You can see that on the map sample I've given below. This pump was popular for its reputation of taste and quality. People said it had a sweet taste, that water. Doesn't bear thinking about what was making the water taste like it. Anyway, Dr. John Snow noticed that the people who drank the water often became ill and died, but that the workers at the nearby brewery, which you can also see on the map if you look closely, who all drank beer, well, they all survived. Snow demonstrated this on a map, on which he marked where the cholera deaths occurred and when he interviewed local people. He wrote up his findings, but initially he was ignored. He then personally removed the handle from the pump and the outbreak stopped. It later turned out that an underground cesspit full of sewage was leaking into the pump. Nice. After his death, Louis Pasteur's germ theory demonstrated why John Snow's idea was correct. But tragically, his ideas weren't actually accepted within his lifetime. He died before they were. So you could say that the problem partially solved here was cholera. Or at the very least, Dr. John Snow found what the particular problem was. He identified the cause, but very few people listened to him. That's why we can only say he partially solved cholera. It would be some time before it was really out the way. Our next solution is Edwin Chadwick, and the few politicians like him. I've given him a mention before, but again, let's recap what he did. Edwin Chadwick was a politician. To begin with, he believed that government shouldn't interfere with ordinary people's lives. We call this laissez-faire politics. But his investigations into living conditions changed his mind. In 1842, he visited working class populations and wrote a report called The Sanitary Conditions of the Labouring Population. In this, he argued that disease was made worse by or caused by filth and dirt, that poor people lived in terribly overcrowded and poor quality houses, and that these conditions caused disease because of the smells that they caused. Yes, that's right, Chadwick believed in miasma. He was so close to identifying the true cause of disease, but not quite there. Chadwick didn't believe that you could force people to make changes for health reasons, though, only that you could recommend that they change things, so many of the laws introduced had very few teeth. So the problem partially solved here is all three, but especially the issue of some slum housing, which he helped bring to the fore. But we'll have to look another time at the laws that were passed. What about solution 3? Joseph Bazalgette. Bazalgette was an amazing engineer. He'd have to be with a moustache like that. London still owes him a great debt of gratitude. After the Great Stink of 1858, Bazalgette was asked by the Metropolitan Board of Works, who were in charge of building projects in London, to build a brand new sewer system to solve the stink from the Thames. Bazalgette's huge new sewers were mostly completed in 1865, and they carried waste safely away from the city and kept the river flowing quickly and cleanly. He also made the sewers big enough to cope if London grew even bigger, which of course it did. Bazalgette's sewers not only solved the stink, but also did a lot to prevent the cholera ever returning by removing sewage from the London's water supplies and keeping it separate from the drinking water sources, even though Bazalgette didn't actually know that cholera was a waterborne disease. Here we can see some of his sewers while they're actually being constructed. You can see the scale of them. Bazalgette set out to solve the stink, and he absolutely did. But in doing so, he managed to clean up the water too, which is what actually stopped the cholera. So the problem solved was the Great Stink and cholera. Well done, Mr. Bazalgette. So let's recap then. Here we can see our summary screen again. We've got some details as to how problems were solved, but we're going to add to it too. So how was the Great Stink solved? Well, the Great Stink was finally solved by the installation of Bazalgette sewers. And how was the cholera epidemic solved? Bazalgette sewers were designed to remove bad smells, but they kept drinking water clean too, and this eventually solved the cholera with the last outbreak in 1866. So are any of these solutions linked? You better believe they are. Well, Edwin Chadwick's ideas began to change the government's view and move away from the laissez-faire, do-nothing approaches of government before. This led to Bazalgette's construction of new sewers, which solved both the Great Stink and the cholera. So it looks like by the end of the 19th century, people are going a long way towards solving the real challenges of public health. Again, the text on this is quite small, so if you want to pause it here, take a screenshot or read it for yourself, do so now. Solution 4 relates to Acts of Parliament. For a long time, the governments of the day had preferred a laissez-faire approach. This means to do nothing. They believed that government should not interfere with people's day-to-day lives, but doing nothing was no longer an option. Parliament was voted in only by a small selection of wealthy landowning men. That meant that for much of the 19th century, they weren't really interested in helping people who were less fortunate. However, as more people got the vote, and as more health problems started affecting even greater levels of society, people decided that they had to start doing something. So with much reluctance, successive governments passed the following laws, and there will be more on subsequent slides. But we're going to start with the 1848 Public Health Act. This is where it all begins. This act recommended that local councils take control of public health problems in their areas. So it granted them the power to charge ratepayers, which we would today call council taxpayers, to raise money to appoint a local board of health, to use this money to keep the streets clean, and to improve water supply and sewerage, also to fight infectious disease such as cholera. But you may have already identified the weakness here. It didn't force anybody to take action, so actually few councils took advantage of these new powers. And indeed, people who didn't want to pay higher taxes were often very resistant to a local board of health being introduced anyway. So no problems were really solved by this first Act of Parliament. The cholera smells and the poor housing continued. But it is a start. Although it doesn't force anyone to take action, it provides a framework for later compulsory actions. And that makes the 1848 Public Health Act still quite important. Our next act is the 1866 Sanitary Act. This extended council powers to enable, but again not force, councils to improve drainage and sewerage of poor quality housing. But it also compelled, that means forced, councils to locate and address nuisances to public health, although these were not well defined and so they were quite easy to ignore. But this does go some way to partially solving all of our three problems about overcrowding, the Great Stink, but also cholera. Now for a law which is far more helpful, the 1875 Public Health Act. By this point, way more men in Britain had the power to vote, and so governments had to start listening to them. This is the big one. Councils were now compelled or forced to charge rates and taxes to appoint a local board of health, as had originally been recommended by the 1848 Public Health Act, to appoint a medical officer in charge of health and inspectors to ensure improvements were actually being made, and to provide and maintain safe water supplies and sewers. They also had to regulate cellar housing, in other words, cellars that were being rented out as actual houses, and lodging houses to improve their quality and improve the quality of the new streets that the houses were built on. Although this in fairness did not deal with the existing slums, that would take some longer time. While this was an often unpopular act with ratepayers because they had to pay more in taxes, councils now had to act. It was no longer optional. And so the problem that was partially solved was all three. And on to our final act, near the end now, the 1876 Artisans' Dwellings Act. Councils were now compelled or forced to forcibly buy slum housing from landlords. Landlords had to sell, they weren't given a choice. They had to demolish slum housing and replace it with housing of higher quality. And they had to get low interest loans from the government to pay for these improvements, which wasn't always popular. Exactly how these improvements were implemented and how much landlords were paid was not outlined. But now there were more secure controls on the quality of housing for working people, the so-called artisans, in the name of the Act. So the problem partially solved here is the population increase leading to overcrowding and slums. A recap of the final points then. The Industrial Revolution caused a drastic increase in the size of towns and cities. This brought problems. Cities were overcrowded, filthy, they stank and were overrun with cholera and other infectious diseases. Governments lacked the knowledge of disease to deal with this, but moreover laissez-faire politics meant that they were unwilling to solve them. Cholera was solved through the efforts of Dr. John Snow identifying the cause as water, well, not that he was listened to at the time, and Bazalgette sewers in London, which also solved the Great Stink. Governments gradually introduced new laws. The 1848 Public Health Act was initially voluntary. It was strengthened by the 1866 Sanitary Act, and then the 1875 Public Health Act made its powers compulsory. Slum housing was gradually reduced through laws like the 1876 Artisans' Dwellings Act, but in reality some remained through to the middle of the 20th century. So, as we can see, there was a lot of progress in public health in the 19th century. This has hardly been a rapid revision video, but we've covered a lot of ground, and so I hope it's been useful. If it has, please like this video and subscribe to the channel for more. But for now, and not before time, I'll just say goodbye and good health.